Nobody ruins their health on purpose. What we all do, without exception, is make silent mistakes that accumulate over years without giving signals until the body can no longer compensate for them. And the most important thing, many of these mistakes are completely normalized. We make them because everyone around us does the same, because nobody ever explained to us that they had real consequences. I am a doctor, and today we are going to talk about the 5 most frequent and most damaging mistakes I see in practice. Mistakes that do not hurt, give no warning, and yet are eroding your health right now as you watch this video. Over the next minutes, we will look at each of these 5 mistakes, exactly what they do to the body, why they are so common, and what you can do to correct them starting today. No pills, no extreme diets, no heroic changes, just real medical information and concrete, sustainable actions. Stay until the end because mistake number 5 is the most silent and most costly of all, and the one most people make for a reason that makes complete psychological sense but has very few positive consequences. The first and most underestimated, chronically sleeping less than 7 hours, thinking it is enough. During deep sleep, extraordinary things happen. The brain eliminates toxic proteins associated with Alzheimer's. It literally cleans itself. The body releases growth hormone to repair tissue. The immune system strengthens, and appetite hormones regulate themselves. When you habitually sleep less than 7 hours, the hunger hormone rises 28%, and the satiety hormone drops 18%. That translates to between 200 and 385 extra calories per day without wanting to. Amygdala reactivity, the brain's fear center, increases 60%, which explains why you are more irritable and anxious when you sleep poorly. And cardiovascular, diabetes, and depression risk all increase significantly. The biggest sleep myth I need to debunk: you cannot recover chronic sleep debt by sleeping more on weekends. The accumulated damage during the week is not fully reversed. What to do? Choose a fixed bedtime and maintain it even on weekends. It is the change with the greatest impact on sleep quality. No cost, no extraordinary effort, just consistency. Second mistake, sitting for more than 8 hours a day without compensating for it. And here comes the part that surprises almost everyone. Prolonged sedentary behavior is an independent cardiovascular risk factor, meaning it is dangerous even in people who exercise regularly. A study published in the Annals of Internal Medicine demonstrated clearly people who sit for more than 8 hours a day have significantly higher cardiovascular risk even if they exercise for 30 minutes daily. The problem is not that you do not exercise, it is that you spend 23.5 hours of the day not moving. Sitting for hours on end slows glucose and triglyceride metabolism, reduces circulation in the legs, raises blood pressure, and elevates systemic inflammation markers. The solution is not to exercise more. It is to distribute movement throughout the day. Stand up for 5 minutes every hour, set an alarm, walk while talking on the phone, take the stairs. These micro movements have a metabolic impact that 1 hour of concentrated exercise cannot compensate for. Third mistake, treating chronic stress as normal, as if being permanently stressed were simply the price of living in the 21st century. Cortisol, the stress hormone, has vital functions in acute situations. It prepares us to act, increases available energy, sharpens the senses. The problem is when it stays elevated chronically, week after week, month after month. The consequences are documented and serious. The immune system is suppressed, more infections, slower healing. Blood pressure rises chronically. The hippocampus, the brain's memory area, literally shrinks. Abdominal fat accumulates, and the risk of depression and anxiety multiplies. But here is something very few people know. Unmanaged chronic stress ages you at the cellular level. Studies on telomeres, the biological markers of cellular aging, show that chronic stress shortens them significantly. Chronic stress literally ages your cells faster. What to do? 10 minutes of diaphragmatic breathing or meditation per day measurably reduces cortisol within 8 weeks. It is not a luxury. It is medical prescription with solid evidence. Fourth mistake, Habitually consuming ultra-processed foods without really knowing what they are or what they do to the body. An ultra-processed food is not simply junk food. It is an industrially manufactured product made with ingredients you would not find in any home kitchen. Emulsifiers, colorants, flavor enhancers, preservatives, added sugars, modified fats. Specifically designed to be hyper-palatable, almost impossible to stop eating. The problem is that in many countries, they represent 50 to 60% of the daily caloric intake of the population, and most people are not aware of how many they are consuming. Documented consequences include higher risk of obesity, type 2 diabetes and hypertension, disruption of the gut microbiome with impact on immunity and mood, increased inflammatory markers, and higher colorectal cancer risk according to large cohort studies. How to identify them? If the ingredient list has more than 5 components and contains words you would not recognize in a kitchen, it is ultra-processed. And the good news, you do not need to eliminate them 100%. Reducing them to 20% of total intake and gradually substituting real foods has an enormous and completely sustainable impact. And the fifth mistake, the most costly and the most understandable, avoiding preventive checkups out of fear of what they might find. This fear has completely understandable emotional logic. If I do not know about it, it does not exist. If I do not go to the doctor, there is no diagnosis. And without a diagnosis, everything is fine. The problem is that the most prevalent chronic diseases, hypertension, diabetes, dyslipidemia, hypothyroidism, some cancers, are completely silent in their early stages. They do not hurt, they produce no obvious symptoms. When they finally give a warning, they are usually already at more advanced and considerably harder to treat stages. Preventive medicine works in exactly the opposite way to what fear suggests. The earlier an abnormality is detected, the easier it is to treat, the less aggressive the treatment, and the better the prognosis. Hypertension detected at 40 and treated with lifestyle changes is completely different from hypertension detected at 60 after a stroke. The minimum checkups every adult should have: blood pressure from age 18 every 2 years if normal. Full blood count from age 25 to 30 every 1 or 2 years. Lipid panel from 35 in men and 45 in women every 5 years. Fasting blood glucose from 45, and a dental checkup every 6 months. Teeth are a mirror of general health. What to do? Book a checkup this week. Not to look for diseases, but to have a baseline of your current health. The best time was 5 years ago. The second best time is today. Tell me in the comments, which of these 5 mistakes surprised you most? Which one do you recognize in your daily life? I love reading your responses and I reply to most of them. And if this video brought you value, share it with someone who needs it. Health is the most important gift you can give to someone you love. If you want this information in a format you can download, save, and share, I have the free guide available. It is called 5 Mistakes That Are Ruining Your Health Without You Knowing. It is completely free, written from a medical perspective, and you can share it with anyone at no cost. The link is in the description and in my profile. And if you want to go deeper on any of these topics, I have complete medical guides available on weight loss, anxiety and stress, cardiovascular health, and wellness myths, all in the description. Subscribe for more real medical content. No commercial agenda, no filters. See you next week.